Hello everyone, welcome back to our channel Small World Aussie. My name is Megha. Today I am going to talk about scenario based interview questions for an AIN position and my answers to them. A bit of a background about me. Now currently I work as an AIN in a public hospital. Before I accepted this position, I was interviewed for almost 8 different hospitals, both public and private. Out of the 8 interviews which I had, I was successful in 7 out of them. Now, why did I choose this particular position? It's mostly because of the accessibility. It's quite close to where I stay, and it offered me a part-time position. I preferred a part-time position for now because I have a toddler that suited my lifestyle better. From my experience of being interviewed, I have compiled a list of most commonly asked scenario-based interview questions. Now, most interviews have a mixture of scenario-based questions and theory-based questions. In this video, I would like to focus on the scenario-based questions. My first question for you is, a nurse hands you some Panadol to give to a patient. What do you do? Before we answer this question, we have to be very clear on the scope of practice of an AIN and the roles and responsibilities. If we are very clear on that, we will remember that as an AIN, you cannot give out medications. So I answered this question that I would politely decline, and I would explain to the nurse that as an AIN, I cannot give out medications and it does not fall in my scope of practice. By doing this, we have clearly shown to the interviewer that we know what our scope of practice as an AIN is and how we will politely act if this ever happens to us. The second question is, you have to transport a bariatric patient to the toilet. What steps do you take? Now, bariatric means an overweight or an obese patient. This was my answer. Before I begin any procedure, I will enter the room, go to the patient, and I would make small talk. I would introduce myself, tell what I am going to do, and then ask for consent. If the patient agrees, then my next step would be to go and get a sling. We have to use an appropriate sling according to the patient's weight, and then I would bring the machine. So the bariatric patient has to be transported into the toilet using a lifter, and I also talked about checking whether the sling is not torn, dirty, whether it's functioning properly. I would also check whether the lifter is not dirty, it's functioning properly, the wheels are rolling properly, the brakes are functioning well. Then I would position this lifter right next to the patient's bed. I would check whether the patient's bed has the brakes on, is of appropriate height. I would then go to the toilet because I am transporting the patient from the bed into the toilet. I would check whether there is any obstruction on the way, whether there's anything on the floor which is a trip hazard. I would also check whether the toilet is clean, whether it's accessible, there's no water on the floor, which is again a trip hazard. And after that, I would be asking for help from one of the other staff, because you need 2 people to always use the lifter, and explain the procedure, what we are going to do to the patient. And once the patient has agreed and I have their consent, I would be transporting the patient safely. With this answer, I have shown to the interviewer that I am assessing risk. Before I do any action, I have to assess risk here. I have to make the procedure easy and safe for me, my colleague, as well as the patient. Even if I do not know how it's done practically, I know theoretically what has to be done. My next question is, you overhear another nurse talk bad about you to another staff. What do you do? So in this case, the interviewer wants to know how you are going to resolve conflicts in workplace, because there's going to be so much conflicts on the ward, because it's you're working with people and conflicts are very normal, it's very common. I answered this question in this way, that if I overhear anybody talking poorly about me, I would ask this person who can I speak to you privately? That can be in the pan room or in the meeting room, where you are sure that you can have a conversation privately and nobody is going to overhear. I would tell my colleague that, see, I overheard you speaking bad about me. What's wrong? Is there any particular reason? Do we have any conflicts between us? I would like to resolve this particular issue in a friendly way. We can say that. And sometimes conflicts are not going to be resolved in that manner. In that case, if this particular issue is not resolved, then I would take it up with my nursing unit manager for further help. If you answer something along this way, you can show to the interviewer that you are a friendly, confident person who wants to resolve issues, and if it does not resolve in a friendly manner, you know what steps you're going to take next. Okay, the next question is, you see a doctor walk into a COVID patient room without any PPE on. What do you do? First of all, I would give a benefit of doubt to the doctor that maybe it's a mistake, maybe he doesn't know that this is a COVID room. I would probably call out to the doctor. I would explain that this is a COVID patient room, you do not have any PPE on. And if the doctor replies to me saying that, oh, that's all right, I'm okay, I'm going to go in quick and come out, I don't need any PPE. In that case, I replied that I would probably talk to my manager or supervisor regarding the incident. And another point is, I would also check whether the PPEs are in stock, whether it's kept near the room. I showed the interviewer that I do not assume quickly, I do not come into conclusions quickly. The next question is, you see that your colleague has posted personal details about a patient on her Facebook page. What do you do? In this case, we have to be really clear and we have to know about the social media policy of NSW Health. We are not supposed to post any personal details about any patient on Facebook. I answered that it is my duty to report this colleague and what she has posted on Facebook page to my supervisor. In this way, you are showing to the interviewer that you are aware of the social media policy and you will do what is right. The next question is, another AIN has given you her share of work to complete. What do you do? Again, in this question, I answered that if this happens only once, it can be due to any particular reason. Maybe she is really busy or she has been given some extra work, and so you understand that this has never happened. This is the first time it's happening. I would probably help her out. But if this happens regularly, I would probably request her that we have a talk somewhere privately, and I would talk to her about how she's putting all her work on me and how I'm finding it quite difficult to complete my work on time. And in case if we cannot resolve it politely and in a friendly manner, I would be talking about it to my supervisor. So in this way, you have shown the interviewer again that you want to help out others on the ward and you are a good team member. Now my final question is, you find a patient on the floor in the toilet. What do you do? When I was asked this particular question, I went quite blank and I didn't know how to answer this question. So I said that I would press the help button and I would call out for help. So I would be with the patient to make sure they get help. After working as an AIN in the ward, so if I am asked this question again now, I would answer it in a completely different way, which is using the short form DRSABCD, which stands for check for danger, responsive, S for send for help, A for open airway, B check for normal breathing, in case not, C start CPR, D attach defibrillator. I hope this video helps you in your interview. If you like my content, do share, subscribe and like. If you have any other questions, do comment in the box below. I have done a video previously on the educational requirements of how to become an AIN. I will give the link of that video in the description box below. Thank you. I accepted this. No. So now the second, I would in